Good afternoon, everyone. On this page, I decided to write about cannabinoid hyponesia syndrome. Just a little background to why I chose this and clarification was that I recently had a family member who was diagnosed with this, and he had severe abdominal pains, constant throwing up, and he hardly ate because he was so nauseated. Any medication we gave him, which included like Hyponesia, Hyponesia, Tylenol, it didn't work. And it was just like a really scary time because we didn't know what was going on. It took literally weeks to almost a month to get a proper diagnosis. I myself have never smoked cannabis, but I thought it was just really interesting to understand what was going on. And after the first episode, which doctors referred to him as, we didn't know what was causing like so much havoc on his body. We took him to the ER multiple times. Each time they tested his blood work and his CT scans, everything came back normal. And then each time they thought it to be like kidney stones, gallstones, even his appendix. But finally, our last visit, he was in so much pain and telling the doctors how unbearable it was. Sorry, no. He said that he couldn't take it anymore and was just so mentally and physically drained. And he was even like contemplating suicide because of how bad it was. At this point, he was throwing up blood, which he thought was a stomach ulcer, but it wasn't the case. After seeing like multiple doctors and explaining to them what was going on, they finally gave him the diagnosis that it was Cannabinoid hyponesia syndrome. In my speech, I would be talking about what CHS is, the symptom, when it was first identified, the differences between Cannabinoid hyponesia syndrome and cannabis withdrawal syndrome, the phases of CHS to watch for, and the recovery. And I hope this really just gives you a better understanding that cannabis is not always good for you like people say it is. And after any long-term use of any medication, there's always some kind of side effects that will take a toll on your body. First off, does anyone know what cannabinoid hyponesia syndrome is? Have you ever heard of it? No. Cannabinoid hyponesia syndrome, otherwise known as CHS, is a condition in which the patient or user experiences clinical nausea, vomiting, and abdominal pain after using cannabis or marijuana. According to earlier studies, CHS was first identified in 2004. Studies also shown that in the past 20 years since cannabis has increased more as a recreational substance, that there have been more cases of CHS. Those who are chronic cannabis users have described the same symptoms. Some symptoms were more worse than others. Some have experienced everything from severe abdominal pain, extreme nausea, and uncontrollable vomiting. But others, they only experienced one or two. So it was more harder to understand what they were going through. But in other cases, doctors had to rule out any other factors that could have been causing distress on the patients. They thought it could have been anything caused from bulimia, anorexia, pancreatitis, IBD, or inflammatory bowel disease, pregnancy, and sickle cell anemia, just to name a few. And the other outcomes, some patients, the only way for them to get rid of the abdominal pain was to take really hot showers or baths. But it got to the point where people were actually getting second and third degree burns from the water. And some people were actually diagnosed with two things. They were called Cannabinoid Hyponesia syndrome and cannabis withdrawal syndrome. For CHS and CWS, they both had the same symptoms, but CHS was far more worse, but both lasted anywhere from 24 to 48 hours. And for CHS, the only time there was relief was with hot showers or the use of capsaicin, topical ointment. Some reported that smoking actually made the symptoms go away, but with CHS, it only made it really worse after they smoked. The three phases of CHS are patients who are suffering from CHS after cannabis consumption. The first phase was the withdrawal phase, which included morning sickness, which lasted months to sometimes even years. The second phase was called Hyponesia, which included abdominal pain after cannabis use. And lastly, the recovery phase, which consisted of the patient deciding if they wanted to keep using or if they were wanting to quit. In some cases, if they didn't stop using, the symptoms will only get worse. And sometimes from them using for so long, it could actually result in death because they would get severely dehydrated and their kidneys would take a toll on them. And the family member that was diagnosed with this was actually diabetic too, so it wasn't good for him to keep going on. He didn't like it, but I'm glad he quit. But with CWS, it actually, like the vomiting and everything went away after smoking, and it was really weird because they don't really understand like why it's causing this. They don't know if there's something in cannabis that is making them throw up so much and get sick. I don't know, it's really weird. Like, it's still a good study that I would like to learn about. But I hope that my speech has given you something to really think about if, you know, someone who is currently using, and understanding that marijuana isn't always a good option, especially if someone is using just for like recreational use. But I know that with the studies going on, they don't know what will help cancer treatment for people who are currently using for the pain.